Welcome everyone to tonight's ACOI Student Lecture Series. The topic for tonight is how to prepare for clinical rotations, and our speaker is Dr. Simona Eng. Dr. Eng is the Associate Vice President of Medical Education, the designated institutional official, Executive Medical Director for Acute Care, and an Associate Program Director for the Internal Medicine Residency at Tidal Health Peninsula Regional in Maryland. She is also an ACOI board member. Dr. Eng, thank you for speaking tonight, and I will turn it over to you.
Thank you for having me. This won't be too long. I know it's you guys have been probably in class rotations and 8 o'clock is late for some if you're on the East Coast and West Coast. Carrie was telling me this was good for you guys, so this is awesome. All right. So how to succeed on rotations? This is kind of my perspective, and I've talked to, faculty and students and kind of put together some slides that I hope will help as you transition from your studies into clinical rotations. So what the three things I look at really are, how do you prepare for your rotations, sense of professionalism when you're on the rotations, and then being adaptable on the rotations. So this is kind of the three things that I look at for success. So before any rotation, and I think this is important, I always tell the students, send an email to your preceptor. You need to introduce yourself. Just tell them a little bit about yourself, a little bio, so that they get to know you. And then always figure out what time and place you want to meet on the first day, because hospitals and clinics are big. So you want to be able to be there on time. And sometimes check out the place before you even start your rotation, because you don't want to get lost in parking or, different entrances of hospitals, etc. The other thing I always, encourage is to make sure you ask about appropriate attire, because it depends on the rotation. Are you going on a surgery rotation? Are you going to the office? So you want to dress the way that your attending or your faculty member expects you to dress. So, and then the other thing you want to know in advance is what materials do you need to read. And then sometimes the faculty will say, "Hey, I have a reading list for you. These are the resources I want you to use while you're on this rotation." And these are the things I recommend you have before you start your rotation so that you're prepared. And I think those are some key things that you want to know in advance. And then you always want to know what kind of electronic medical records they have, because not everybody has the same. Epic is obviously expanding out, and Epic does take some time to learn if you haven't used it before. Some places use Cerner and some use older systems. So you want to know if you have to come in early for training on the same day of training and how much training you need. Because some places allow you to actually document in their EMR as medical student notes. Other places do not. So you want to get to know that in advance, because there is a little bit of a learning curve with doing the notes. And you can stop me at any time, by the way. This is like the most informal lecture. Um, the other thing before the rotation, depending on the rotation, you want to kind of know what the common conditions are that you're going to be seeing, either in the hospital, in the office. Are you on a cardiology rotation? Do you want to focus more on cardiac issues, treatments and procedures in that specialty? The other thing you want to make sure you do is really familiarize yourself with the anatomy in the area that you're focusing on. And of course, pharmacology was always big, and then what the most up-to-date clinical guidelines are. And sometimes hospitals do have access to clinical resources that you could use there, but your attending should be able to guide you in that. They'll be like, hey, maybe you should use X, Y, and Z journal or X, Y, and Z textbook to kind of stay up to date. Or they can say that we have hospital resources. So I always tell students, kind of figure out what goals you want for the rotation. So you want to reflect on what you want to learn and achieve during the rotation. But you also want to make sure your attending or the resident that you're with knows your goals early on. And I think that's essential for that two-way communication. I always say that you want feedback every day, because you're not going to know how you're doing if at the end of the 4 weeks you get your feedback. So just be frank with your residents and with your attendings that you would appreciate feedback. Be it good, bad, or ugly. That's the only way you're going to learn. And everybody makes mistakes. I still do. So it's okay. So during the rotation, you want to show up prepared. and you want to be on time. So again, arrive early, especially if you have to learn the electronic medical records. Um, I encourage students to pre-round, especially if they're in the hospital, to make sure that they review their patients before rounds and know their vitals, their labs, etc. Write it down. You don't have to memorize it. You can print it. EMRs are pretty cool now. And then be ready to discuss your patients. So, you may have a resident on your team that assigns you, 2 or 3 patients to follow. Make sure you know those patients. And then offer to assist with tasks. Sometimes a resident may say, hey, go help nurse X with getting an EKG, and just go into the room because you'll learn all kinds of different things from nurses as well. I say be proactive, and that means show initiative because you don't want to show up on a rotation where you look like you really don't want to be on that rotation because the attendings and the residents know. So again, volunteer to take on patients if you have to. Don't be afraid to present cases because that's the only way you're going to learn to be good at it is just to present. And you're gonna fumble a couple of times and it's okay. But it'll get you better at knowing how to present cases when you do it frequently. Also ask for opportunities really if you want to do procedures or learn skills. And that could be anything at the bedside that your attending or your resident will allow you to do. I know a lot of places now have sim centers. They want you to go through the simulation center before you practice on a patient, which is good. So ask in advance how you can assist with procedures. Do you have to go through the simulation course at Hospital X or whatever before you can do anything? So know that in advance. The other thing is also one of the biggest things I say is stay organized. You want to be able to keep track of your patients. And again, you can print a lot of your lists from the hospital or clinic EMRs. Make sure you know their conditions and what treatments they're currently on. And if you have to use an old-fashioned notebook. People still carry notebooks, or if you have an app on your phone, you can jot it down, or, whatever is easier for you and whatever people use nowadays. I'm still an old-fashioned jotted on a notebook for me. So during the rotation, being a team player, I think is always key. You want to be able to help your fellows, your students, your residents, nurses, and be able to show respect for all the members of the healthcare team because it's no longer the doctor, I'm the captain of the ship. It's a healthcare team. It's a team sport. So within that, you want to be able to communicate effectively. Again, learn to present cases, present as much as you can, be clear, concise, and make sure you use a structured format such as a SOAP note. Now, there's some hospitals that don't like the SOAP note and they may reverse it and they do what's called an APSO note, or the assessment and the plan are at the top. And then your subjective and objective are on the bottom because they really don't care about that part. So it really depends. Check with your institution, check with your rounding team and see how they prefer their notes formatted. And also during the rotation, ask, thoughtful questions. And if you don't understand something, ask. It's okay to say you don't know something. You're not going to know everything, and not everybody does. And it's okay to look things up. But also demonstrate curiosity during the rotation. If you don't know something, ask. But also read up on your cases. So if you see a patient that you're curious about that, you're like scratching your head, go home and read about it. And then you'll be more prepared next day to talk about it. And then show interest in learning by asking for feedback. I think that's always key because you're not going to know how to improve unless you start asking for feedback. And attending sometimes are afraid to give feedback. I will say that's a common topic that is always presented at faculty development is how to give good feedback. So don't be afraid to ask. Also during the rotation, maintain professionalism. I think it goes without saying, but I always say be respectful, approachable, and positive. And it always dress appropriately. And again, there are institutional policies I think that people aren't aware of. Some institutions don't allow X, Y, and Z. So just be aware of that. And then focus on the patient care. Like treat patients like you want to be treated with compassion and respect. And you also want to make sure you build rapport and really practice good bedside manners. So what do you do after the rotation. And I think this is the part where you reflect on your experience. So you want to look at what you gained from your rotation, what are the strengths, where you can improve, and how are you going to know that? Again, is asking for feedback from your residents, from your faculty. And hopefully you'll be able to have an open relationship where your attending can be frank with you, with where you know, your strengths are and where your weaknesses are. And I think residents also are being taught how to give feedback to students as well. The other thing I think is important is to stay in touch. Keep in contact with your faculty, with the residents, especially for future opportunities and letters of recommendation. And I encourage that. I think so. We have a core clinical campus with a couple of medical schools for our institution, and I can tell you that students constantly still text. They're telling me what rotations where they're going in their future matches and all this. And I think that's a neat thing for us as attendings, that we can see where folks are going and where their professional journey is taking them, and use feedback constructively. So again, don't look at it as a negative. Work on skills and knowledges where you think you have gaps on the rotation. Again, you're not going to know everything. So feedback is critical. And I can't say that enough, because faculty are learning how to give good feedback. And I think we, as students, you need to learn how to take feedback constructively as well. So my kind of words of wisdom, I guess is what I call them, is make sure you're diligent, you're enthusiastic when you show up for your rotations, but also remain humble. And this will really leave a lasting and positive impression on the team. So again, by combining your thorough preparation, being engaged, committing to continuous improvement, and that's continuously learning, I think you can make the most of your rotations and really build a strong clinical career. And then one of the things that I think is important is being grateful, because preceptors really donate a lot of their time to mentoring students. They don't get, this is not a get rich scheme for attendings. I think the people that teach want to do it because they want to give back to their profession. And I think this is the way to do it. Nobody's out there to be negative. But again, I always say, I remember one of the biggest things is connecting when I was a student with my attendings, because I took a little bit of each from every attending that I learned, and it turned me into who I am today. I have little pieces of everybody. I probably have a bigger piece of Dr. Kaiser Smith, who is on here, because she was my kind of my mentor when I was a resident, actually. And I think I followed a lot of her footsteps. I mean, she became eventually DIO, and she became my mentor throughout this process. So as a student, you start building that foundation of connections with your attendings and even with your senior residents. And I think that's important, because our community remains strong because we have those connections. So again, don't be afraid to ask questions. I think your 2 years on rotations will go by really, really fast. You thought the first two dragged with classes, but the third and fourth years will fly by. And if you think, the last 2 clinical years of your medical school's fast, wait till your residency, because then you'll be like, wow, I'm an attending. What do I do now? So, I think it's fun. Enjoy it. This is not a long lecture. I didn't want it to be, because it was late, and I just wanted to get the key points across, because I actually wanted to open it up for questions, because I think it's always good to have a dialogue rather than presenting, because I always think people tune out. So I am happy to take questions from anybody about any rotations, anything that you may have questions about. And there's a lot of people on this WebEx here who have a lot more experience than I have, that's been teaching a lot longer than I have. So I'll open it up to anybody that has questions tonight. Oops.
Doctor,
Those are my-
let me just ask you, what strikes you as something that's really negative? I mean, maybe it's the opposite of all the things you said to do, but what are the things that run in your mind that create maybe a negative assessment for the student?
For a negative assessment of a student, I think it's for me, it's we've had some evaluations on students that may have been negative because they unfortunately were supposed to be at a certain rotation and didn't show up for the rotation. And that reflected negatively on their evaluation because then they lied about it. So lying, I think, is a bad thing. So I would, be honest. If you're out for a reason, just tell the preceptor you're out for a reason, but don't lie to say that you were there and weren't there. I think that's really bad. I think we've had some of those. So we've had people miss rotations. They say they were at X and they weren't there for 4 days. They were somewhere else. So yeah, I see Daniel shaking his head. Yeah, we've had those, trust me. So
Simone, it's Dr. Kaiser Smith. Thank you for those kind words.
Hi there.
Just one thing that I would like to add from my years of being a teaching attending. There's no such thing as a bad answer. So on teaching rounds, when questions come up and you may not know the correct answer, but you think you have a bit of an idea, say something. I can take what you're saying and move it along and come up with, a good explanation or a discussion item. If all I see is deer in the headlights and no speech whatsoever, I have a hard time working with that. So you're there to learn. So, don't be afraid to come up with an answer. Maybe it's a half answer, or maybe you aren't sure. Because I think, then you get people talking. And if you are a quiet, shy person like I am, and you don't talk on rounds, then that was a joke.
Yeah.
People don't know what you know. Okay, so to any of you who are not from New Jersey and you're not bold and brassy, you need to make sure that your voice is heard so that you answer questions. I need to know what's in your brain. Okay, so just to the point, just don't be afraid to say something because it's a lot better than silence. That.
I just want to build off of that, kind of make a question. So it's better for us to like say something even if we don't have the complete picture, because at the very least it seems like we're trying. Is that what I'm getting at? Okay.
Exactly.
Okay, that makes sense. I think all of us would just be afraid of like kind of seeming like we're dumb, for lack of a better word, you know.
Again, you're a student, right? I mean, you're paying money to be taught. And I don't, no one is ever going to call you dumb. Look at what you've accomplished. You made it through college, whatever else you did, and you got accepted to medical school. You're not dumb by any stretch. If you knew everything, then you'd be making rounds. Okay, that's your goal, is to become the attending, to learn everything. I just think that if you say something, offering it out, again, I'm not sure, but this is what I think. I would rather hear that than nothing at all.
We have a follow-up in the chat about if you have any tips on how to work on that, on asking questions.
Like asking, go ahead.
I'm going to sign off now.
Oh, so is it asking questions about something you don't know about a patient or about a topic, or I didn't see let me see if I can see the chat. Hang on. See if I know how to do it.
She was referring to speaking up, like tips on how to be more vocal, speak up when you have a question.
Yeah, I mean, the other thing is if you don't want to speak up during rounds, just ask the resident or a senior resident or attending on to the side, say, hey, can I just ask you a quick question? I think if you can't do it in the group, which I understand, trust me, like if you're in big rounds with a whole bunch of residents and students and attending, I get that. So if you can't do it in the open area, then just ask off to the side, hey, I have a quick question. It's okay. And the other thing I get some feedback from students is people learn differently. I think there's still some attendings that like to quote pimp. And then there are some that like to give small lectures. There's some that give homework assignments to the students and then they report back. So I think everybody has a little bit different style, which is why I always ask, or I tell the students to ask how they learn best. So that way the attending knows. Because maybe you don't like to be pimped. Maybe you're better off, getting a small assignment and say, hey, look up this topic and you present it for the first 10 minutes before rounds. So I think that's important to understand so that the attending knows how you learn. What else? Did I miss another question? Oops.
I have a quick question, Dr. Ng.
Yeah, yeah.
So from your perspective, what specific behaviors distinguish an average student from an excellent one?
Well, that's a good question. I get asked that on the interviews too. So for me, I think as long as so it's not, for me, it's not grades, it's not how much knowledge, it's how motivated you are. You show up every day, you show up on time, you show up prepared, you're professional, you're nice to the staff, you're good to the patients. I think that shows initiative. It's not how smart you are, right? So for me, that's the most important because I think if you put the effort into it, your attendings and your residents know that at the end of the day. That's what really makes it for me. Show up on time, be present. Don't be looking at your phone on round. I do see that. Like, don't be preoccupied looking at Facebook or TikTok while you're on rounds because that shows you're not interested. Like, don't pull out your phone in the patient's room or something. Be interested in the patient and listen to the patient. You can look up stuff later on. And truly, because everything's on the phone now, right? If you don't know something and the patient's talking, don't pull out your phone while the patient's talking. Step out of the room and look at the stuff later and then come back if you have to tell the patient something. But I think that's key. Yes, be a team player. Exactly. That's exactly right. So,
Thank you.
mhm. Oh, it is a question. So you mentioned using a notebook. I would not put HIPAA information in your notebook. So don't put like social security numbers and that kind of stuff in the notebook. Usually when I use a notebook, I'm using it more for something I need to look up. Because now, like at EMRs, you can print your list, right? It has the patient's name, room number, all that stuff on there. But actually, you got to make sure you dispose of it correctly too before you leave the institution. So yeah, the notebook I have is usually when I was a student, I just put in information that was pertinent to a disease or something I needed to look up, not necessarily specific to a patient. Because we used to print our patient list and I used to jot labs down on, and vitals down. That's how I kept track of, my patients during rounds. Sure. What else can I answer for anybody?
So one of the pieces of advice I have been given, maybe not from this session, from others, is to try to make contact with the residency director, especially if that's a site that you're interested in, or also to try and get a letter in order to go to kind of make your application stronger. I was wondering if you have any sort of recommendations on doing that, or am I just completely overthinking it and it's just send an email?
No, so we've had students do that. So we have different students that rotate through our institution, and if they're interested, for example, in family medicine, they may try to do a rotation with the program director for family medicine just so they can quote audition with them. And then, getting a letter from them, getting to be able to show their interest with the program director does make an impact. I will tell you that. And that goes the same if you've been a core clinical campus student within an institution for your entire third year. They know you. So to get a letter from any of them to enter any of the residencies there would be phenomenal. I don't know if that helped you. But yeah, I think it makes a difference. Especially the core faculty too. So if there's like letters from core faculty that you've worked with and you're interested in that program, associate program director, or any of those are fine.
Awesome. Thank you so much.
Yeah. Are you
Very
interested in a certain area now already, or have you figured out?
Yeah, kind of just generalist hospital. I am
Oh, very
kind
good.
of what I want to go for. Yeah.
Awesome. Awesome. Oh, so Dr. Good has a question here. Oh, are there consistent student deficiencies that you notice of third or fourth year students in internal medicine, pharmacology, treatment plans, and compassion? Oh, it's a good one. Pharmacology, yeah, that's a big one. I do think there is a gap in pharmacology. I'm not sure why. Maybe I need to go back to some of these schools and figure out if there's just a difference in how pharmacology is taught now. I knew that was a huge section when I went to PCOM, like a very big section. So I don't know if they've carved out some of that. Treatment plans, I think, are okay. The problem I think I see now, especially with our EMRs, is this copying and pasting thing. And so we frown upon that, and I kind of stress that to the students. I don't want you to copy somebody else's plans. I want them to be able to think on their own, whether it be right or wrong. But yeah, that critical thinking really is important for the treatment plan. And compassion, I will say, is a good one too. I think, and Dr. Good, I'm going to go down this route. I don't know if like this generation of attachment to phones has created a little bit of, I don't know if there's a little bit less compassion. I'm not sure if there's a connection sometimes to people. That's why I tell people to put their phones away. I don't want to see their phones during rounds. Now, of course, our beepers are connected to it now and stuff like that, and Epic's connected, and everybody wants to Epic chat with you on the phone or whatever. But I tell them to try to do that outside of the room and not in the patient's room. Again, I want the focus on the patient while we're in the patient's room. So I think when people are pulling out their phones or looking at their phones, it just sends a bad message so that they're not interested in the patient. So that's a good one. Look up all the medications your patient is on. Yes. Know the indications for the drug, why it's being used, mechanisms of action, side effects, and drug-drug interactions. Yes, that's exactly. Yep. And there are a lot of drugs out there now. Good Lord. So
and some are being used off label, so that's why I said make sure you know why it's being used in that patient. So it could be, gosh, remember when metformin first came out and then they started using it for everything else under the sun. So
yes, absolutely. Can you speak to student performance on rotation? Yes, I briefly touched upon this. Again, be present. And it's not an act. I mean, you're interested, you went into medicine for a reason. So I'm hoping you're not acting. Like Dr. Kaiser-Smith says, be interested, be on, be attentive, do all your, and there are things that happen in a personal life and it's hard not to bring it to work or to, your education sometimes. We get that. But for the most part, these patients are sick, they're in the hospital, they're in the clinic, they're not feeling good or feeling well. So be present for them. Because I think that speaks a lot, and being interested in the patient. So I think that's where Dr. Kaiser-Smith was going. Not focusing on social media, phone stuff, that kind of stuff. That's right. Every patient can teach you something, even if it's not medicine related. I will tell you, yeah, that is absolutely true. So I don't know, in our, we've created these, I call them baseball cards. So all the residents have them too. I learned it from one of the universities, but it has your picture on it on the back. It has your hobbies and your interests and stuff. We give it to patients when we first meet them because there's tons of people that walk into the patient's rooms and they don't know who's who. But when we give them the card, we put it on the table and they look at it. They're like, "Oh, you like fishing," and then they start talking about fishing, or you like cars, and they start talking about cars. So I think it's not all about medicine, and that is true. So they can teach you stuff. Patients have a lot that they can teach us other than that. You never know when the program directors talk. I don't know what that means, Dr. Kaiser-Smith.
That means when you're on OB and you basically are disinterested and pay no attention because you want to be an internist, and the OB attending is a good friend of the internist program director, and they talk. So, which has happened several times. So, if you're disinterested and a faculty member sees that and then speaks to the person who runs the program that you want to become part of, it follows you. So basically, you never know who's watching you, and you don't want to appear disinterested or bored or not interested in learning, because that behavior can follow you. Does that make sense?
That does make sense. But also, there's so much to learn, whether regardless if you want to do internal medicine. Like I had to do peds when I was an intern. I did 4 weeks of peds. I loved it. Like there's so much to learn. It doesn't have to be, there's a lot to learn.
Yeah, and if you're on OB as an internist and you want to be an internist, geez, you get called for consults for hypertensive, hypertension and pregnancy. There's so many different things that you can get called upon to consult. So you got to learn,
Exactly. Hey, I learned how to suture when I was in OB as an intern. So you learn all kinds of stuff. That is true. All specialties cross over at some point, especially internal medicine. You jack of all trades, master of none. What else? Did I miss some? I know there's stuff on here. Anything else?
I have a quick question.
Sure.
So in my school, we do student-directed learning, and typically, like in our case-based learning groups, when we ask the professors or the physicians any questions about the case, a lot of times they'll ask us to look in a textbook or try to answer it ourselves. And I feel like I'm getting very used to that. I'm getting conditioned for that. So when it comes to rotations, obviously there's going to be a lot of scenarios where we're not going to know certain things, and we're going to have doctors around us. And I just want to hear, do you feel like that would be something that would be good to continue for the most part, to maybe not bother the doctors or ask them too many questions? Or do you feel like I should just be trying to get as much information as I can from them, and just be curious?
I would be curious. Again, if you tell your attending this is the way I learn, then that's a trigger to them to say, okay, this student likes to learn this way. And we should be able to adapt to that, because not everybody's going to learn the same way. And that was a lot of the feedback that the students sent in their evaluations to the faculty, because I read all the faculty evaluations too. So, because I want to make sure that the faculty get appropriate development on how to teach students and how to teach residents. So I think feedback on that is important. And when I hear that learner A prefers this, and you start to see that routinely, then that means that that's how they're learning in medical school now, which is different than when we learned. So I think learning to teach differently to different audiences is important. And that's something that we're trying to do better at, which is why we hired a faculty development person within our organization to help with that. I think we need to try to learn to teach differently to different audiences. So if you like asking questions, ask questions. If you prefer to look stuff up and then, answer later, that's fine. Just some you don't know right now, but you'll look it up and you'll report back the next day. It's okay.
Okay, thank you.
Are there any books or resources that you recommend before any rotation? Again, it depends on the rotation. Like if it's OB, it's whatever whatever you're attending recommends for OB. If it's internal medicine, it's ID. I would check with your attending before the rotation, because there may be special certain resources or textbooks or journals that they want you to know to read up on or during the rotation. So. Let's see if I missed any. Anything else? I don't think I missed anything, Kara, on this. I'm looking on the chatty chat.
I think you're good. I think you got them all.
Okay.
I have another quick question.
Sure, Gia.
So in terms of asking for a letter of recommendations, what are some resources that you think attendings would appreciate getting? For example, like a CV or personal statement outline. Like what's some things I could give to help with that process?
Yeah, definitely your CV. The personal statement I like to look at because it kind of tells me a little bit about you as a person. And of course, on your CV, hopefully some of your scores and other things, your activities, what you like to do, what you don't like, what scholarly activities you've done, posters and abstracts, those kinds of things are important. Anything that was different than your normal traditional track of going into medical school. Some people have a different life before they entered medical school. I think that sometimes adds a lot of value to writing a letter because it's a different path. I've seen some of those students before who decided to be a bartender and then became a paramedic and decided they want to go into medicine. So life isn't like a direct path from high school to college to medical school to, residency and being a physician. So it's okay. People take different paths to get to where they are. It brings different life experiences, I think. So, but those are the biggest things I usually look for. So.
Can I have a comment? I'm sorry, this just came to me.
Yeah.
Social determinants of health are so important these days, and so some of you students might be in the same hospital for the entire third year, but you're going into your fourth year, you're going to be traveling around, or even if you're third year, it's really important to know what the neighborhood is, the community where you're going. So, we have several hospitals. One is a inner city critical care hospital, where if you knew what Camden, New Jersey was about, you might have a better understanding of the patients that are there and the stresses that they have to go through to get healthcare. Perhaps you're working in New York City, or maybe you're in some, rural area in, Pikeville, Kentucky, and you really, it's new to you and you don't really know what services the patients have available. So I think trying to immerse yourself a little bit in the community of the patients that you'll be taking care of will help give you an idea of, what they're trying, how hard it is for them to actually get medical care or to follow the directions or get the prescriptions that you prescribe for them because of either financial or other issues.
Yeah, those are great points. Because you got to figure out where you want to spend your time. Do you want to spend in the rural area? Do you want to spend it in the city or suburban area? Because those patients are all different in different areas. Because I'm in a rural area, considered rural, I think, based on the hospital designation. And I know Dr. Kaiser-Smith is not rural, but she is in a huge health system that has different populations in different areas. So it also depends on what you want to get out of your education and where you want to get your education for your clinical experience too. Dr. Good has, what about clinical research on your rotations? So good question. Our students have the ability to do research. We have a research institute within our health system. So if you're a student that's interested in doing a subspecialty, which obviously is one of those that may be competitive, like cardiology, GI, hematology, oncology, they're going to want to know what type of scholarly activities you have done. And that may be it could be, article reviews. It could be whatever clinical research is going on in institution. You can tack on to somebody's, research. I think that's important, particularly if you're going into a competitive residency or a competitive fellowship in the future. They always look at that research or scholarly activity bucket. But is that the question that you were kind of going with, Dr. Good? Yeah. I remember, God, when we didn't even care about all that stuff, and then it's how hard you worked and how much effort you put into being present, like Dr. Kaiser Smith said, being present in the rotation. If you like GI and you started rounds at 4:30 in the morning, they knew you were interested in GI. Now it's more focused on, your interest in the clinical research piece. And I think that's how we separate out some of the applicants now, especially with the really competitive residencies as well as the fellowships. Let's see. Hospital quality projects are also interesting. Yeah. So there are opportunities as students to be involved in, for us at least, for hospital quality projects. One of the big ones we always seem to recycle back is telemetry use. It seems to come up every year. I don't think there's ever going to be a solution for this. We seem to have brought it back up again because the amount of people, it's always 100% use in the hospital. And people are on telemetry forever and ever and ever. So we have students on it, we have residents back on it, we have cardiology fellows back on it. I don't know if we'll ever get to a point where we'll get any improvements in reducing telemetry use, but length of stay, so those are things that students can get involved in, and that can go on your CV. I always think it looks good too. When answering questions from attendings or resident, is it bad to say I don't know, or is it preferred to take your best guess? I think you can do both. You can take your best guess, and if I guess it really depends. You can say you can take your best guess. I don't think it's any worse than, I don't think it's bad either way to say I don't know or take your best guess. If you don't know, you don't know. And I don't think your attending or your resident should, penalize you for that at all. Just tell me you're going to look it up and you'll report back tomorrow or later. It's okay. Let's see if I missed any. Anything else? I don't think I see anything else on the chat, Kara.
No, I think you're up to date on the chat. Does anyone else have any questions?
How much should I read a night? For you, Dr. Kaiser Smith, I don't know. So when I was on call, I actually read like my book. I would just go through things if I was on call or whatever, or if I was wrapped up with a resident and they haven't had anything to do, I would just go through some key stuff. We used to have I forget what they called it. It was like his little survival book for the most common things you get called on, like hyperkalemia, chest pain, those kinds of things. So if you kind of like have a little bit of downtime at night, just flip through some quick pages. I think those are always good refreshers to read. So Kaiser Smith said at least 1 hour a day. Okay, I like that. Washington Manual, yes. That is true. Yes. And I did have that. That was a book back then. I don't know if it's digital now, but yeah, we used to have to carry that in our pocket. Used to rip holes in your pockets all the time because it gets to be so heavy, but yeah. What else? Oh, love the Little Brown series. Washington Manual was a key. That is true. Everybody's looking everything up on their phone now. I don't see anybody carrying books anymore. So, and then we have Up to Date. I think it's a lot of information on Up to Date, to be honest with you, but I know that's a huge resource for a lot of students and residents. So we have access on our computers. That is true. AI is not always correct. Neither is this ChatGPT. Yes, that is correct. Oh, so we started using AI. So we're testing our little AI with Epic now. What it does is it actually summarizes our notes in Epic. So our hospitalist group are kind of the first users because obviously we don't want to test it out on the surgeons because I think they would just lose their mind right now. So so medicine folks are doing it. It's okay. It's not bad. I think it's going to help, I think, with some of the handoff because it is summarizing a lot of the key information from all the different consultants. We have an AI, I assume a lot of hospitals have it, an AI subcommittee. We have residents on ours because, and fellows, because we want the input. We want to make our systems better. But we also use, it's not necessary, it's part of AI, but it's called DAX. It's like you kind of, it's like, oh, it's your Apple iPhone. You walk in, you start talking and it dictates your notes for you, which is kind of cool. So that way you don't have to have a scribe. And it's pretty accurate, actually. It still learns your voice and it gets better and better every time you use it. So I think that's hopefully improving the efficiency for the physicians in the offices and stuff. But yeah, AI, I think the biggest one is going to be for radiology. I think they're going to be able to pick up things that, because radiologists now are reading like hundreds and hundreds of films on one patient. Like one CAT scan, I think is like 800 slices. I mean, that's ridiculous. So I think they get tired, but I think AI is going to help with a lot of that too.
Dr. Engel, thank you for taking your time to do this tonight for the students. It's very, very helpful. And
Yeah, thank
this
you.
is recorded, so it should be a legacy into the future so people can get back and watch it. So good answers to good questions.
Thank you. I enjoy this. I think it's fun to really interact with the students, and I think it's watching everybody grow and, be better than us. I'm telling you, people are so much smarter than I think Kaiser Smith and I talked about this. Students are so much smarter than where we were back then. So, but thank you for being here. And I know it's late for a lot of you on the East Coast and West Coast. You're still bright and it's dinner time for you people.
All right. If no one else has any questions, we can wrap up. Thank you, Dr. Eng, for the
Thank
lovely
you.
lecture and the Q&A. I just put in the chat the schedule for the rest of the student lecture series for the academic year. Just a couple quick items. We have 2 sessions left. On April 16th, we're doing a Q&A panel regarding insights for successful residency interviews. And the May 14th panel will be a residency prep. So the link in the chat gives you the schedule, and it also includes links to the registration. And new this year, we actually want to get direct questions from the students. So please feel free to submit questions that you want us to make sure we ask our panelists for the April and May sessions. And then that's all I have. So thank you, Dr. Eng, and thank you all the students and Dr. Good and Kaiser Smith and Cavanna. And have a good night, everybody.
Thank you. Have a great night.